Hello and welcome to the Osteophysio YouTube channel. Today we're going to be talking about why am I getting anterior rib pain. That's pain anywhere from about here down to here, around the front.
So we have lots of different joints that are involved in our rib mechanics and in movement, and we're going to be talking about why pain occurs in each of these, because we seem to be seeing a lot of rib pain lately, so we want to take away the mystery of why we're getting pain in different areas. So what we've got in terms of the rib anatomy is we've got our sternum here, so the bone around the front of the chest, and you've got the ribs blending into the sternum. So what happens is we've got two main joints here and here. So we've got the sternochondral joint where the rib blends and attaches into the sternum, and then the costochondral joint, which is a little bit more lateral.
So these joints are like any joints in the body. They can get inflamed, they can become a little bit hypermobile or a bit restricted, and these things can lead to pain and discomfort. The classic one that people come in with, diagnosed from the GP, typically Costochondritis. So you see that a lot, don't we? And that's, you know, pain here, any movement, and it can come on for no reason really, but any movement through the upper body can bring it on. Coughing and sneezing, they say, is absolute agony, and that's true for any rib problem really. Sometimes it can click a little bit as well, can't it? Do you find it's typically one joint, two joints usually?
Oh, it's very difficult. Obviously, no one truly follows the pattern that we learn in the anatomy books, but you normally find it's quite isolated, very, very specific, unilateral. That's what I found from my experience, is people can almost pinpoint over the joint where the pain is. Like you were saying, coughing and sneezing and stuff like that. Obviously, we're in cold season at the moment. Any coughing and sneezing repetitively can actually inflame and aggravate through the joints as well. So it doesn't always have to be trauma into the ribs and into the rib cage, or anything repetitively where we're either reaching or throwing with that side that can aggravate. It can just be that repetitive coughing or sneezing that can inflame through the areas. And so what we would normally recommend as osteopaths is obviously getting the rib moving, reducing that inflammation, so typically with ice as well, and then stretching through, and then that leads us on really nicely to the intercostal muscles.
Yes, the intercostal muscles, intercostal meaning between the ribs. You've got 3 layers of them between each of the ribs, all the way around. They wrap round, and when they spasm, it can be excruciatingly painful. The level of pain it always seems a bit disproportionate to the level of injury. I think it's because your ribs are protecting such important things. So when something goes wrong, your body really lets you know about it. And it's the same thing really, coughing and sneezing and stuff like that.
Laughing.
And pain, and it can radiate round, and you'll find it maybe between anywhere really. Between 1 or 2 ribs or 3 or 4 ribs. And it'll, you know, sometimes go around, sometimes it'll be around the, you know, go all the way around the back as well.
And typically one-sided. Again, you could get it both sides if you've had a real kind of coughing fit or real kind of situation where everything's been quite tight. Of course you can get it around both sides. We normally find it one side, and someone tends to go into a position to ease it. Because you think if you're bringing the ribs together, you're relaxing the muscles, so it makes sense to kind of hold yourself in a slightly kind of side bend, flex position to help with the pain. And the reason why ribs are such a nightmare, we find obviously diagnosing and treating, like Oliver said, really sensitive, but also we use our ribs all the time, you know, communicating, laughing, moving, breathing, of course, breathing are related to the ribs. And so we see a lot of people with quite a lot of tightness through the diaphragm. So underneath the domes of the diaphragm, attaching underneath the floating ribs, you find your diaphragm is your big muscle helping with breathing. So if you've had a period where you've been flexed forward, or you've had any trauma through the body, or you've been quite stressed, we find that people get really, really tight through the diaphragm, and they feel like they want to kind of hook their fingers underneath the ribs to relax it.
Absolutely, and that's especially true at the moment with things like chest infections. People get a lot of restriction all the way around the rib cage. Stops breathing properly, and then of course that manifests into more problems, you know, the following year, because you're not expelling air properly, and so on and so on.
It can manifest like that. And so what we would look at treatment wise, and I know we've done a really detailed video on how to release the diaphragm properly, is that we would want to relax through all attachments. So we want to release underneath the dome, so underneath the ribs, we want to relax through there. Obviously getting all the ribs moving, which is the same similar treatment to obviously the very specific pain into the joints and into the intercostal muscles, as well as your accessory muscles of breathing. So if Oliver turns his head a second, you've got obviously your scalenes and your SCM and your traps around here. If this is all really, really tight, these are the muscles that we tighten to help with breathing. And that's why when people have a lot of pain, they tend to become upper rib breathers, and you see a lot of tightness up through here as well. Plus people with chronic asthma, you know, something quite similar with the accessory muscles too. And then finally, we want to touch on a little bit of referral. So when it's not related to the ribs.
Well, yeah, of course, that's always a bit of a red flag. Pain coming that isn't mechanical. So obviously, the first thing we think of is pain from a heart attack or referral from cardiac referral. Typically left-sided, can be right. It comes up in the neck into the jaw, sometimes down into the hand as well. So you get other symptoms of that, shortness of breath and stuff like that. So it's it's just worth taking into consideration.
And obviously we would screen for that in our systemic screen. So any palpitations, shortness of breath, fatigue, like you said, you can see in someone's pallor like how they've changed, but also any history of cardiovascular issues. So is this a one-time thing, or have they got a history of hypertension and cardiac issues? Obviously we test mechanically, see what's going on, and if anything flags up that's not mechanical, send on for referral. And then the other one I want to touch upon is on the right side, underneath the ribs, you've got your gallbladder and your liver, gallstones, any inflammation of your gallbladder, any aggravation or issues with the liver can also refer up to the right shoulder. So due to its nerve supply, it can refer up to the right shoulder, and they can get like a dull ache up in here, as well as systemic symptoms with that. So steatorrhea, so fatty stools, aggravation and pain on eating fatty foods, obviously because of the role of the gallbladder helping break down fatty foods. And so it's never that clear cut, so that's why we do such a detailed case history. Is it mechanical, or do we need to send on?
Exactly, there you go.
Great today. And then we'll take off